SOMGauge is SomnoMeds' latest innovation developed to empower dentists to take accurate and reliable bite records. The SOMGauge has been designed to suit all SomnoDent products, ensuring they fit right first time. The clear, rigid fork has a 3mm thickness to ensure the bite does not need to be opened or closed during the production of your SomnoDent. The unique ramp design supports the teeth, allowing the clinician to check and adjust vertical, thereby ensuring adequate clearances across the entire occlusal scheme. The ramp additionally provides uniform support to teeth throughout silicone bite recording process, and the ergonomic handle is made of durable materials that can be cleaned in the autoclave. Step 1. Loosen upper and lower screws and place the slider over lower incisors at the skeletal midline. Move the slider towards you to contact the lower anteriors, then tighten the lower screw to secure the slider. Step 2. Remove SOMGauge from mouth, insert the bite fork and reinsert over lower anteriors at the skeletal midline. Choose the bite fork size so that most posterior teeth are at least partially covered by the bite fork. Forks may be adjusted using a handpiece or scoring with scalpel and gently snapping off with pliers if necessary. If a distal wrap is required, the most posterior teeth must be fully covered by the bite fork, which may increase the vertical opening of the bite record. Step 3. Instruct the patient to gently close onto the bite fork so that the upper anteriors close completely into the ramp and contact the guides on the fork. Tighten the upper screw to secure the bite fork. Loosen the ramp screw. Move the ramp towards you to contact upper anteriors. If an anterior breathing hole is requested, you must ensure that at least 5mm opening is provided between the two closest front teeth. This ensures adequate material maintained for appliance integrity. This final position is a preview of the vertical dimension required for a SomnoDent device. Step 4. Tighten the ramp screw to secure the ramp and loosen the upper screw to unlock the bite fork. Instruct patient to move mandible to centric position and record the value indicated on the ruler. Instruct the patient to move mandible to full protrusion several times. Record the maximum value achieved as indicated on the ruler. Remove SOMGauge from mouth and secure at the desired starting position, such as 2/3 between the centric and full protrusion settings. Reinsert the SOMGauge over the skeletal midline as before, and instruct patient to gently reclose into established protrusive position. Step 5. Using a stiff silicone, inject the medium thoroughly on left and right sides, extending completely from anterior to posteriors. PVS is recommended for reliable bite records. Once the medium has hardened, remove SOMGauge from the mouth. Loosen the upper screw, remove the bite fork, and send the fork to your local SomnoDent provider. The handle, slider, and upper and lower screws can be cleaned in an autoclave after use. Visit SomnoMed.com to purchase SOMGauge today.